Tad, I keep reading articles like 10 ways to achieve mental well-being, and some of the things that which they recommend are have 8 hours of sleep every day, eat food rich in omega-3 fatty acids, pick up a new skill or a hobby, go for a walk, among others and all that. I mean, do these cookie cutter approaches actually work in maintaining the well-being of an individual, or should we just dismiss them and then carry on with our lives the normal way?
All right. So my direct answer would be it may not or may not.
Mm-hmm.
It may work or may not work. It may work for some people. It may not work for others.
Mm-hmm.
However, in general, if you were to ask me, these help in one way or the other to make an individual to feel that they or she or he is into some action which is very beneficial. Okay, because I'm following certain things because I read it or I heard about it. I'm doing it. In that way, there is a way that these people could feel that they are doing something very beneficial to them. So, but if you were to ask me, this wellness generally applies to physical body. So, and wellness programs usually tend to focus on disease prevention and management, actually speaking. Or there could be health assessment as well as other efforts for people at a high risk, right? Group of people. That is why. For example, a person is obese, so they give wellness program, the diet as well as the physical exercises, weight reduction program. But well-being refers to more holistic, your whole of life experience. So therefore, the cookie cutter approaches that you were talking about may not be enough to make you feel happy and healthy in the long run. So as I told you, well-being itself is a state of being happy, feeling happy and healthy, correct? So for that, you may need to understand and manage your cognition and your emotion and your action or the behavior on a daily basis. So that is very, very important.
All right.
So to sum it up, it may work for some people, it may not work, but that is related with the action you can take to address your wellness, but that is not enough for your well-being.
Okay, so yeah, so that brings me to a supplementary question. See, for instance, when it comes to physical health, okay, I have an option of going in for a medical checkup, right? So I do that every 6 months just to make sure that that everything is in shape and there are no alarms for me to worry about. Are there any such things which are available when it comes to mental health?
Is very much available across the world, across the globe, and as well as in India. So the awareness of the people probably, the awareness needs to get enhanced, probably among people in India so that they seek professional help. For example, I have fear of height, or I have catastrophe. Okay, so I have a phobia with closed places. Can be treated? Yes, of course. Obviously. Maybe because people are not aware that these are scientific, these are very clinical, this can be addressed very systematically using evidence-based scientific interventions. So probably that awareness is, and the social stigma, the taboo attached to mental health is another issue. Correct. So probably if that is getting addressed, I think people will come forward. As you rightly said, for your mental health, you have assessments like what you go through your physical health. You have assessments, you have medications, diagnoses are made, interventions are provided. So for example, you have a physical pain, or you consult a physician. He may prescribe you some painkiller.
Right.
Am I right? And he may suggest you that we're going to think of a physiotherapy as well. Wrong, they will teach you some exercise as well. So both physical therapies and the medical intervention, they are going both hand in hand. The same way, mental health, there is no health without mental health.
Right.
Correct?
Yeah.
So if we want to address that, there is a way to address it systematically and scientifically. So there will be psychotherapy as well as there will be medication.
Mm-hmm.
So for the pain that you have taken the medicine, like that, psychological conditions or psychiatric disorders, you will have pharmacological interventions as well as psychological interventions.
Okay.
Correct?
Right.
Yeah.
So why
That
isn't why isn't that being so very well promoted the way the physical health is being promoted? Are there any specific reasons for it? So
I think Sabha, combination of factors. It is not the cause and effect that I am talking to you, but there are combination of factors. So one factor could be like if you take abroad, the other countries except India, if you're not except India, maybe most of the developed countries, the global north.
Right.
Yeah. In the global north, all the countries, your mental health is part of your health insurance.
Okay, all right, I get that.
So it is very important for you to get assessed your mental health, part of your regular checkup and part of your intervention, health intervention, almost all the countries in the global north. But when you take India, even the health itself, physical health insurance itself is out-of-pocket expenditure.
Right.
Right? A country like this, so though the physical health, which is very apparent, very visible, that itself is going out of your pocket. It's not covered by national health insurance or whatever. There's a lot more difficulties for people to go through timely therapies, which will take months and years. It is not like a physical ailment that you patch up your muscles where it was torn, then you sutured it and you wanted to get healed. So it is a mind to deal with that, with behavioral, with psychological issues. It is time consuming as well as a lot of time and money and effort are involved. The part of the people, family members and the professionals.
Okay.
That is one of the major things. Another thing is that though there are awareness, probably we have not adequate mental health professionals in India. So the lack of trained mental health professionals will make things very difficult for people to access the service.
Okay. Right.
And the kind of the finance or the kind of budget that we provide for mental health is maybe the least than anything else. So a lot more factors are involved. And the social perception that, if you want to go and seek a help for mental health, what others think of us, that we are not normal. So they will consider that we are abnormal. So people are very, very scared of the social stigma and the taboo attached to it. Though the scenario has changed, the situation is much better now, but nevertheless, still people really harbor these same feelings and perceptions around mental health. But it has improved.
All right. So yeah,
there are so many factors. Many factors.
Yeah, I get the picture. Thank you so much for that, Pat.